Have you ever noticed that constant feeling of mucus in the back of your throat? That annoying sensation that makes you want to clear your throat every few minutes? The feeling that something is always stuck there, no matter how much you cough or swallow. If you're over 50 and dealing with this, you're not alone. This is one of the most common complaints I hear from people in this age group. And it's incredibly frustrating because it affects your daily life in ways that are hard to explain to others. You're constantly clearing your throat during conversations. You feel self-conscious in quiet settings like meetings or church because of the throat clearing. You might have a persistent cough that won't go away. Sometimes the mucus is thick and difficult to clear. Other times it feels like a constant drip down the back of your throat. This condition has a medical name. It's called postnasal drip or upper airway cough syndrome. And while it can happen at any age, it becomes significantly more common and more persistent after age 50 for specific physiological reasons. Let me tell you about someone who dealt with this for over 3 years. This gentleman was 68 and had been constantly clearing his throat for so long that it had become an unconscious habit. His wife was frustrated because he did it constantly, even interrupting conversations. He was embarrassed about it, but felt like he couldn't help it. There was genuinely something in his throat that needed to be cleared. He tried over-the-counter medications, home remedies, everything he could think of. Nothing worked for more than a day or two. He was convinced he'd just have to live with it as part of getting older. But when we finally identified the actual cause, which turned out to be a combination of 3 different factors that commonly occur after age 50, and addressed each one systematically, his symptoms improved dramatically within 2 weeks. Within 6 weeks, the constant throat clearing was almost completely gone. He told me it had such an impact on his quality of life that he couldn't believe he'd lived with it for so long without getting proper help. Today I'm going to explain exactly why this mucus problem happens so frequently after 50, what the common causes are, and most importantly, what you can actually do about it. This isn't something you just have to live with. Let's start by understanding what's actually happening in your throat. To understand why you feel mucus in your throat, you first need to understand what mucus actually does and why your body produces it. Mucus is a normal, healthy substance that your respiratory system produces constantly. Your nose, sinuses, and throat are lined with tissues that produce about 1 to 2 quarts of mucus every single day. Yes, you read that correctly. 1 to 2 quarts daily, even when you're perfectly healthy. This mucus serves important protective functions. It moisturizes the airways, traps dust and particles you breathe in, contains antibodies that fight infection, and prevents your nasal passages and throat from drying out. Normally, you swallow this mucus without even noticing it. It mixes with saliva and goes down your throat throughout the day and night. You're not aware of it because the consistency is thin and the amount is manageable. The problem occurs when either the amount of mucus increases significantly, or the consistency becomes thicker and harder to swallow, or the sensation in your throat becomes more sensitive to the presence of normal mucus. Often after age 50, it's a combination of all 3 factors. When mucus accumulates in the back of your throat, instead of being swallowed smoothly, you get that constant feeling of something being there. This triggers the urge to clear your throat or cough. The irony is that frequent throat clearing and coughing can actually make the problem worse by irritating your throat tissues, which then produce even more mucus as a protective response. Understanding this cycle is important because it helps explain why some of the things people do to try to fix the problem, like constantly clearing their throat, actually perpetuate it. Now let's talk about the specific reasons why this becomes such a common problem after age 50. Reason 1, medications. One of the most common reasons for increased mucus sensation after 50 is medication side effects. Many medications that people start taking in middle age and beyond can directly contribute to mucus problems. Blood pressure medications, particularly a class called ACE inhibitors that includes drugs like lisinopril, enalapril, and ramipril, commonly cause a chronic dry cough and throat irritation. These medications can affect the throat's sensitivity and mucus production. Studies show that up to 10 to 20% of people taking ACE inhibitors develop this chronic cough. Antihistamines for allergies, while they're meant to dry up mucus in your nose, can actually make throat mucus thicker and harder to clear. They reduce the watery component of mucus, but the thick component remains, creating that sticky feeling. Many medications cause dry mouth as a side effect. Antidepressants, anxiety medications, medications for overactive bladder, some pain medications, and many others. When your mouth and throat are dry, normal mucus feels more noticeable and uncomfortable because there's less saliva to help you swallow it smoothly. Diuretics for blood pressure or heart failure can cause dehydration, which thickens mucus throughout your respiratory system. The challenge is that by age 50, many people are taking multiple medications. The average person over 65 takes 4 to 5 prescription medications regularly. Each medication might have a small effect on mucus, but combined, they create a significant problem. A woman in her early 70s came in complaining of constant throat mucus that started about a year earlier. When we reviewed her medications, she was taking an ACE inhibitor for blood pressure, an antihistamine for seasonal allergies, and a medication for anxiety that caused dry mouth. She was essentially on 3 different medications that were all contributing to her symptoms. We worked with her healthcare provider to switch her blood pressure medication to a different class that doesn't cause cough, adjusted her allergy treatment, and found an alternative anxiety medication. Within a month, her throat symptoms had improved by about 70%. If you're taking medications and experiencing persistent throat mucus, this is absolutely worth discussing with your healthcare provider. Often there are alternative medications that can treat your conditions without causing these side effects. Reason 2. Acid reflux and GERD. One of the most underdiagnosed causes of chronic throat mucus after 50 is acid reflux, specifically a condition called laryngopharyngeal reflux, or LPR. Most people think of acid reflux as heartburn, that burning sensation in your chest. But LPR is different. It's when stomach acid reaches all the way up to your throat and voice box without causing the typical heartburn symptoms. Many people with LPR have no chest discomfort at all. What happens is that stomach acid irritates the delicate tissues of your throat and voice box. In response, these tissues produce extra mucus as a protective mechanism. You end up with thick mucus that feels like it's constantly in your throat, along with symptoms like hoarseness, chronic throat clearing, the sensation of a lump in your throat, and a persistent cough. Why does this become more common after 50? Several reasons. The lower esophageal sphincter, the muscle that keeps stomach acid from coming up, weakens with age. Many people gain weight around the midsection with age, which puts pressure on the stomach and forces acid upward. Hiatal hernias, where part of the stomach pushes through the diaphragm, become more common with age. Research published in the journal Laryngoscope found that LPR affects up to 30% of people who complain of chronic throat symptoms, and it's frequently missed because people aren't experiencing traditional heartburn. A gentleman in his mid-60s had been dealing with constant throat mucus and hoarseness for over 2 years. He'd seen multiple healthcare providers who treated him for allergies and sinus infections with no improvement. Finally, someone suspected LPR and did a scope examination of his throat. Sure enough, his voice box and throat showed clear signs of acid damage. He was started on medication to reduce stomach acid production and made lifestyle changes, eating smaller meals, avoiding food for 3 hours before bed, elevating the head of his bed, cutting back on caffeine and alcohol. Within 6 weeks, his symptoms improved dramatically. The key insight here is that throat mucus isn't always caused by problems in your nose or sinuses. Sometimes the culprit is actually your stomach. Reason 3. Chronic sinusitis and allergies. While acid reflux is underdiagnosed, chronic sinusitis and allergies are probably the most commonly recognized causes of postnasal drip, and they definitely become more problematic with age. Your sinuses are air-filled cavities in your skull around your nose and eyes. When these become inflamed or infected, either from allergies, environmental irritants, or bacterial infections, they produce excess mucus that drains down the back of your throat. After age 50, Several factors make sinus problems more common and more persistent. Your immune system becomes less efficient at fighting off infections. So, sinus infections that might have cleared quickly when you were younger now linger for weeks. The tissues lining your nose and sinuses change with age, sometimes developing polyps or structural issues that block normal drainage. When mucus can't drain properly from your sinuses, it sits there, becomes thicker, and eventually drips down your throat. Environmental allergies can actually develop or worsen in middle age. Many people assume that if they didn't have allergies as a child, they won't develop them later. But adult-onset allergies are quite common. You can suddenly develop sensitivity to pollen, dust, mold, or pet dander that never bothered you before. Additionally, many people over 50 spend more time indoors than they did when younger, which increases exposure to indoor allergens like dust mites and mold. Year-round allergies to dust mites, mold, or pet dander are particularly problematic because they cause constant mucus production rather than seasonal symptoms. A woman in her late 50s had developed what she thought was just getting more colds as she got older. She'd have weeks of sinus congestion, facial pressure, and thick postnasal drip. Then it would improve for a while, then come back. This pattern had been going on for about 3 years. Allergy testing revealed she'd developed significant allergies to dust mites and mold, neither of which had bothered her earlier in life. She also had early signs of chronic sinusitis. With treatment that included managing her allergies, using a nasal steroid spray, and making environmental changes to reduce allergen exposure in her home, her symptoms improved substantially. The pattern of chronic sinus issues is often overlooked because people assume they're just dealing with frequent colds or sinus headaches, rather than recognizing it as a chronic condition that needs proper treatment. Reason 4, decreased saliva production. This is a factor that many people and even some healthcare providers overlook. As you age, your salivary glands naturally produce less saliva. This condition, called xerostomia or dry mouth, makes the normal amount of mucus in your throat feel much more noticeable and uncomfortable. Think about it this way. Saliva helps you swallow. It lubricates your throat and helps mucus slide down smoothly. When you have less saliva, that same amount of mucus that you used to swallow without noticing now feels thick and sticky. Saliva production decreases with age for several reasons. The salivary glands themselves produce less saliva as part of the natural aging process. Many medications cause dry mouth, as we discussed earlier. Dehydration becomes more common with age because older adults often don't feel thirsty even when their bodies need water. Mouth breathing, which becomes more common with age due to nasal congestion or sleep apnea, dries out your mouth and throat. Caffeine and alcohol, which many people consume regularly, have dehydrating effects. Research in the Journal of the American Geriatric Society found that dry mouth affects up to 30% of adults over 65, and the prevalence increases with age. A man in his early 70s complained of feeling like he constantly had phlegm in his throat that he couldn't quite clear. When asked about his mouth, he mentioned it often felt dry, especially in the morning. He was drinking only 1 or 2 glasses of water per day, had 3 or 4 cups of coffee, and was on several medications that caused dry mouth. Increasing his water intake to 6 to 8 glasses daily, cutting back on coffee, and using an over-the-counter saliva substitute at night made a significant difference. The mucus sensation in his throat decreased noticeably because he had more saliva to help him swallow it comfortably. This is often one of the easiest factors to address, yet it's frequently overlooked. Reason 5, thickened mucus from dehydration. Related to decreased saliva production is the issue of general dehydration affecting mucus consistency throughout your respiratory system. Your body needs adequate water to produce thin, easily cleared mucus. When you're dehydrated, your mucus becomes thicker and stickier. This thick mucus is much harder to swallow and much more likely to accumulate in your throat. After age 50, you're at higher risk for dehydration for several reasons. Your sense of thirst becomes less reliable. Your kidneys don't conserve water as efficiently. Many medications have diuretic effects, You might intentionally limit fluids to avoid frequent nighttime bathroom trips, which ironically often makes urinary symptoms worse. Studies show that many older adults exist in a state of chronic mild dehydration without realizing it. The mucus in your nose, sinuses, and throat is about 95% water when properly hydrated. When you're dehydrated, the water percentage drops and the mucus becomes thick and tenacious, exactly the kind that feels stuck in your throat. A woman in her mid-60s had been dealing with thick throat mucus for months. When asked about her fluid intake, she admitted she probably drank only 3 or 4 glasses of liquid total per day, including coffee and tea. She avoided drinking water because she didn't want to wake up at night to use the bathroom. Increasing her water intake to at least 6 glasses daily, drinking most of it before dinner to minimize nighttime bathroom trips, made her mucus noticeably thinner and easier to manage within just a few days. Simple hydration is often overlooked as a solution because it seems too easy to be the answer. But for many people, it makes a real difference. Reason 6. Anatomical changes in nasal polyps. As you age, anatomical changes in your nose and sinuses can contribute to mucus problems. The tissues in your nose change over time. The cartilage can weaken, sometimes causing the nasal passages to narrow. Polyps, which are soft, non-cancerous growths, can develop in the nose or sinuses. Nasal polyps are particularly common in people over 50 and are associated with chronic sinusitis, allergies, and conditions like aspirin sensitivity. These polyps can block normal drainage from your sinuses, causing mucus to accumulate and then drain down your throat in an irregular, uncomfortable way. A deviated septum or other structural abnormalities that might have caused only minor problems when you were younger can become more symptomatic with age as tissues change and you develop other contributing factors like allergies or reflux. Sometimes previous injuries or surgeries to the nose or sinuses can cause scar tissue that interferes with normal mucus drainage decades later. If you've tried managing your throat mucus with lifestyle changes and over-the-counter treatments without improvement, it's worth seeing an ear, nose, and throat specialist who can examine your nasal passages and sinuses to check for polyps or structural issues. These problems often require specific treatments, sometimes medications like nasal steroid sprays, sometimes procedures to remove polyps or correct structural abnormalities. Now that you understand the various causes, let's talk about what you can actually do about chronic throat mucus. First, stay well hydrated. Drink at least 6 to 8 glasses of water daily. If you're concerned about nighttime bathroom trips, drink most of your water before early evening. Thin mucus is much easier to manage than thick mucus, and hydration is the simplest way to thin it. Second, review your medications with your healthcare provider. If you're taking an ACE inhibitor and have a chronic cough, ask about switching to a different blood pressure medication. If antihistamines are thickening your mucus, discuss alternative allergy treatments. Look for medications that might be causing dry mouth and explore alternatives if available. Third, address acid reflux if that's contributing. Eat smaller meals. Avoid eating within 3 hours of bedtime. Elevate the head of your bed by 6 to 8 inches. Limit caffeine and alcohol, and avoid foods that trigger reflux for you. If lifestyle changes aren't enough, talk to your healthcare provider about medications that reduce stomach acid. Fourth, manage allergies and sinus issues. Use a saline nasal rinse daily to flush out mucus and allergens. Consider allergy testing if you have year-round symptoms. A daily nasal steroid spray can reduce inflammation if used consistently. Control environmental allergens in your home with air filters and regular cleaning. Fifth, avoid throat irritants. Don't smoke and avoid secondhand smoke exposure. Limit alcohol, which can irritate throat tissues. Be cautious with very spicy foods, which can increase mucus production. Avoid excessive throat clearing, which irritates tissues. Instead, try sipping water or swallowing hard. Sixth, use a humidifier, especially at night. Dry air thickens mucus and irritates throat tissues. A cool mist humidifier in your bedroom can make a significant difference, particularly in winter when indoor heating dries the air. Seventh, try steam inhalation. Breathing steam for a few minutes can help thin mucus and soothe irritated tissues. You can do this in a hot shower or by breathing steam from a bowl of hot water with a towel over your head. Eighth, consider your sleeping position. Sleeping with your head slightly elevated can help prevent mucus from pooling in your throat overnight. Many people find that a combination of these approaches works better than any single intervention. The key is consistency. These solutions work best when you make them regular habits rather than just trying them occasionally. While chronic throat mucus is usually not dangerous, there are situations where you should definitely see a healthcare provider. Seek medical attention if your symptoms persist for more than a few weeks despite trying over-the-counter remedies and lifestyle changes. If you have blood in your mucus or phlegm at any time, if you develop fever, severe sore throat, or difficulty swallowing along with the mucus, if you experience unexplained weight loss, if you have significant hoarseness that lasts more than 2 weeks, if you have severe postnasal drip that's affecting your sleep or quality of life, your healthcare provider can examine your throat, nose, and sinuses, potentially order tests like allergy testing or imaging studies, and determine if you need prescription medications or referral to a specialist. An ear, nose, and throat specialist can perform a detailed examination of your nasal passages, sinuses, voice box, and throat to identify specific issues like polyps, chronic sinusitis, or reflux damage. That constant feeling of mucus in your throat after age 50 is frustrating, but it's not something you just have to accept as an inevitable part of aging. The most common causes are medications that affect mucus production or throat sensation, acid reflux reaching your throat, chronic allergies or sinusitis, decreased saliva production, dehydration causing thickened mucus, and anatomical changes like nasal polyps. The good news is that each of these causes has effective treatments or management strategies. Often it's a combination of factors, which means you might need to address several issues simultaneously to get full relief. The gentleman I mentioned at the beginning who dealt with this for 3 years before finding relief, his problem turned out to be a combination of 3 factors. He was on an ACE inhibitor that caused throat irritation. He had undiagnosed acid reflux, and he was chronically dehydrated. Addressing all 3 issues made the difference. Start with the simple interventions. Drink more water. Review your medications with your healthcare provider. Try managing reflux if you think that might be contributing. If those don't help enough, consider seeing a specialist who can identify other contributing factors. You don't have to live with constant throat clearing and the frustration of feeling like something is always stuck in your throat. With the right approach, most people can significantly improve or even eliminate these symptoms. Take care of yourself and don't hesitate to seek help if home remedies aren't working. This is a quality of life issue that deserves attention and treatment.